Welcome to the New Employee Benefits presentation. This presentation is a supplement to the New Employee Benefits book you will receive in the mail from your Healthcare Benefits Division, HCBD, upon starting your job. You can access an online version of the New Employee Benefits book at any time by clicking on the Healthcare and Benefits Division logo on each slide. We highly recommend you carefully read the New Employee Benefits book to gain an understanding of your benefits and choices. You can visit the HCBD website at www.benefits.mt.gov at any time during the presentation by clicking the link. If you have any specific questions that are not covered during this presentation, please email or call the Healthcare and Benefits Division. The State of Montana Benefit Plan, State Plan, is self-funded. The funds that pay for plan member expenses and benefits come from two places. The first is state share. This is a per-month contribution paid by the state of Montana on behalf of each employee. This amount is set by the legislature and funded by income from state taxes. The other place money comes from is you, the plan member. Your monthly benefit contribution is calculated based upon who is enrolled on your plan and what optional benefits you have selected. When you go to the doctor or dentist or fill a prescription for medication, a bill is sent to one of our third-party administrators, or TPAs. The state plan contracts with these TPAs to process and pay claims based on the benefit design and coverages of the state plan. A small amount also comes out of the state plan to pay administrative costs like healthcare and benefit salaries and the contract fees for the TPAs. This is a very small amount of our yearly spend. Any remaining funds are used to fund plan reserves. Plan reserves are used to offset and save for unexpected costs the state plan may be responsible for, such as federal or state regulatory mandates and larger than expected claim costs. In order to take full advantage of the state plan benefits, you will need to enroll in benefits within the first 31 days of your date of hire. If you enroll in benefits within the first 31 days of the date of your hire, your coverage will be effective as of your hire date. As a new State of Montana employee, you will be notified via email when the enrollment system is available for you to enroll in benefits. Please watch your email for this very important notification. If you have any questions or concerns, please contact the Healthcare and Benefits Division. If you miss the initial enrollment period, you automatically waive coverage. As an employee, you can enroll in core benefits after the first 31 days, and your effective date will be dependent on when you enroll. But you will miss out on enrolling in optional benefits offered, such as life insurance, dependent life insurance, long-term disability, and flexible spending. If you do not enroll within the first 31 days of your date of hire, you will only be able to add dependents to your benefits during a special enrollment period or during the annual open enrollment period, which occurs annually for 2 weeks each fall. When an employee enrolls in benefits, they must be enrolled in core benefits. Core benefits include medical, dental, and basic life insurance for the employee only. Medical coverage includes prescription drug coverage and coverage for one annual eye exam. You have optional benefit choices as a State of Montana member. You have the option to add a spouse or domestic partner, and or a dependent child or children under the age of 26. If you enroll a spouse or domestic partner and or dependent child or children, you will be required to provide documentation upon enrollment which verifies their eligibility as your qualified dependent. You and your dependents are also eligible to enroll in optional benefits like vision hardware, flexible spending, extra life insurance, and disability insurance. See your new employee benefits book or visit the Healthcare and Benefits website for more information regarding optional benefits. The next slides will provide details regarding how much each optional benefit will cost you on a monthly basis. Remember the discussion about the state plan being self-funded? This slide shows the out-of-pocket costs you pay based on how many people you cover and if your covered spouse or domestic partner participate in the Live Life Well incentive program. As a new employee, you will have the opportunity to participate in the Live Life Well incentive program and earn an incentive toward your monthly benefit contributions for the next plan year. As you see at the top of this slide, the state share contribution amount of $1,054 per employee per month. See your new employee benefits book or visit the Healthcare and Benefits website for more information on the Live Life Well incentive program. Monthly out-of-pocket costs for optional dental for dependents and vision hardware for all dependents you cover on the medical plan are listed. This slide shows the monthly out-of-pocket cost for the optional benefits of flexible spending accounts, additional life insurance for you, the employee, your spouse or domestic partner, and/or dependents. Also listed are the monthly costs for accidental death and dismemberment, AD&D coverage, and the monthly cost for long-term disability coverage. As a state plan member, you and your covered spouse or domestic partner and/or child or children receive medical benefits as defined by the state plan. In addition to medical benefits, you each receive one annual eye exam with a $10 copay at a participating provider, prescription drug coverage, and the use of all Montana Health Centers at no cost. Allegiance Benefit Plan Management processes the medical claims for the state plan. Cigna processes the vision claims for the state plan. Remember, it's the state of Montana that decides the rates, out-of-pocket costs, and coverages. You will receive an identification card in the mail from Allegiance, Cigna, and Navitus Health Solutions. Listed on this slide is a summary of the copayments, deductibles, and benefit percentage amounts for the medical plan. All deductibles and maximums will be based upon a plan year, which is January 1st through December 31st. Please review your new employee benefit book, pages 12 and 13, for complete details on the medical plan cost sharing. If you use a non-participating facility or provider in Montana, you pay the cost sharing shown on the previous slide, and the state plan will pay a fair rate for your care, but the non-participating provider may balance bill you for more. You are responsible for this balance bill, and it does not count toward your deductible or your max out-of-pocket. If you use an out-of-state, non-participating provider or facility, the cost sharing is shown in the table. Remember, these amounts are separate from the deductible, benefit percentage, and maximum out-of-pocket for participating and non-participating providers and facilities in Montana. Navitus Health Solutions is the state plan's pharmacy benefit manager for the prescription drug plan. With Navitus, you have a retail network pharmacy 34-day option for filling prescription medications, as well as a retail network or mail order 90-day option. Lumicera is the preferred specialty pharmacy for specialty medications. You will want to visit www.navitus.com to get information regarding the state plan's participating network of pharmacies, as well as review the formulary, which is the listing of covered medications and the tier in which they are covered. You have the choice to fill your maintenance medications and get a 90-day supply at a local, in-network pharmacy or at any one of the state plan's 3 participating mail order vendors: Costco, and you do not have to be a plan member at Costco, MyRx, or Ridgeway. When filling a 90-day supply of medication, you can receive a 3-month supply of medication for a 2-month copay. Please consult your new employee benefits book for details or visit the HCBD website for more information on the prescription drug plan. Here's a look at the prescription drug plan copay structure. Notice that if you are on a maintenance medication, or a medication that you take every single day, you save money by using the 90-day fill option, as you receive 3 months of medication for just 2 times the copayment. Tier 0. Certain preventive medications are $0 at either retail 34-day supply or retail mail order 90-day supply. Tier 1 are preferred generics and some low-cost brand products that are $15 for a 34-day supply and $30 for a 90-day supply. Preferred brand products and some higher-cost non-preferred generics are $50 for a 34-day supply and $100 for a 90-day supply. Tier 3 are non-preferred products that are paid at a 50% coinsurance for either a 34 or a 90-day supply. The coinsurance you pay does not apply toward the maximum prescription out-of-pocket amount of $1,800 per individual or $3,600 per family. Tier 4 are specialty medications provided by Lumicera and are a $200 copay. If you get your specialty medications from a retail, network, non-preferred specialty, or out-of-network pharmacy, there is a 50% coinsurance, which again does not apply to the maximum out-of-pocket amount. The prescription drug plan has a separate maximum out-of-pocket from the medical plan. The maximum out-of-pocket for the prescription drug plan is $1,800 for an individual or $1,600 for a family. Tier 3 and 4 coinsurance amounts do not apply to the prescription drug plan maximum out-of-pocket. Delta Dental is the TPA that processes the state plan's dental claims. Remember, it is the state that decides rates, out-of-pocket costs, and coverages. Delta Dental provides members with 3 network options: preferred provider, premier dentist, and non-network dentist. Choosing a preferred provider results in you, the member, paying the least. Contact Delta Dental by phone or online to ask questions about claims, billing, request a cost estimate, or check the network status of your dental provider. You can also refer to the new member benefits book or HCBD website for more information on the dental plan. This slide shows the reimbursement amounts set by the state plan for dental services. The state plan pays an annual maximum of $1,800 per enrollee per calendar year. The dental plan applies a $50 deductible per enrollee or $150 per family per plan year to the basic and major benefits. Please note, the diagnostic and preventive benefits are not subject to the deductible. The Vision Hardware Plan is an optional benefit elected by the member. When electing the Vision Hardware Plan, be aware that any dependent, whether spouse, domestic partner, and/or child or children covered by the medical plan, must be enrolled in the Vision Hardware Plan. Remember, every covered member on the medical plan receives 1 routine vision exam per year for a $10 copay. The Vision Hardware Plan is for frames, lenses, contacts, and specific add-on features for your glasses. You must re-enroll in this benefit every year during open enrollment. Review the details of the Vision Hardware Plan in your new employee benefits book or on the HCBD website. Employees and covered dependents over 2 years of age who are covered by the state plan can use any of the Montana Health Centers. The state plan has health centers in Anaconda, Billings, Butte, Helena, Miles City, and Missoula. Non-Medicare eligible retirees and their non-Medicare eligible dependents can use the Montana Health Centers for all services. Medicare eligible retirees and their Medicare eligible dependents can only use the health centers for flu shots and health screenings. The Montana Health Centers are much more than an urgent care. You can make a Montana Health Center doctor your primary care provider. The Montana Health Centers provide same kind of services that a regular doctor's office provides. If you already have a primary care doctor, you can still use the Montana Health Centers at no cost for physicals, health screenings, lab work, vaccines, and more. Call and ask the Montana Health Center if you have any questions about what kind of services are available. The Montana Health Centers are operated by a company called Care Here. The state plan pays 100% of the costs associated with the care plan members receive at the Montana Health Centers. That means that any service you get at the Montana Health Center is paid in full by the state plan. You'll never get a bill. However, please be aware that services received outside the Montana Health Centers apply to regular state plan benefits even when a Montana Health Center provider makes a referral. You are eligible to participate in medical and dependent care flexible spending accounts. The flexible spending accounts are administered by Allegiance Flex Advantage. As an employee, you can set aside up to $2,550 for medical-related expenses, and you have the ability to roll a maximum of $500 of medical flex money over to the next plan year, as long as you elect to participate in the medical flexible spending program in that next plan year. The money is for qualified medical, dental, and vision expenses for you and your dependents. Check Allegiance's website to see a full list of qualified medical expenses. Dependent care flexible spending has a maximum contribution limit of $5,000 per plan year. This money may not be used for medical expenses. Dependent care contributions must be used to pay charges associated with child care for children under the age of 12 or for qualified disabled dependent care while you are working. For more information on the flexible spending account options, refer to the New Employee Benefits book or the HCBD website. If you elect to participate in either one or both types of the flexible spending accounts, you will be charged a $2.26 per month fee for the administration fee associated with the flexible spending accounts. Additionally, if you elect to get a debit card to have immediate access to your flexible spending account funds, you will be charged an additional $1 per month fee. Every employee who enrolls in the state plan is required to enroll in the basic life insurance benefit. The basic plan costs $1.90 per month and gives you an additional $14,000 worth of coverage. As a new employee, you will also be eligible to enroll in dependent life. If you enroll in the first 31 days or within 60 days after getting married or the birth of your first child. As a new employee, you may elect to participate in the optional employee life plan at an amount equal to your annual salary within the first 31 days of your date of hire, without completing an evidence of insurability, or EOI. You may elect optional employee life coverage at any time up to $500,000, but anything over your annual salary amount, and including your annual salary amount if not elected in the first 31 days, is subject to evidence of insurability. The optional spouse life plan is available if you have elected optional employee life. Coverage is available in $10,000 increments and is available up to the amount you elect for optional employee life. Any amount elected over $10,000 is subject to evidence of insurability. Accidental death and dismemberment is available within the first 31 days of hire and is not subject to evidence of insurability. With the exception of the basic life, all the other life benefits may be increased or changed during open enrollment or at any time with evidence of insurability. This benefit is provided by the Standard Life Insurance Company. Every employee has access to Guaranteed Long-Term Disability (LTD) insurance in the first 31 days of hire. If you do not enroll in the LTD coverage within the first 31 days of your date of hire, you must wait until open enrollment to sign up, and you will be required to complete an evidence of insurability and be approved for coverage. This coverage is $9.90 per month. In the event you become disabled, the insurance would replace 60% of your pre-disability wage starting 180 days after you become disabled, and the coverage would last for 24 months. The Live Life Well Incentive Program offers you an opportunity to participate in state-sponsored wellness activities that will add up to savings on your monthly benefit contribution for the following plan year. All activities must be completed by October 31st to be eligible to receive an incentive for the following plan year. First, get a state-sponsored health screening at a Montana Health Center. The sooner the better. Earn $5 per month toward your monthly benefit contribution. Note, you must complete this state-sponsored health screening to earn any of the incentive. Second, be nicotine-free or have a nicotine counseling session with your primary care provider or complete a nicotine cessation program. Earn $10 a month toward your monthly benefits contribution. Third, complete an eligible next step activity related to your health screening results. Earn $15 per month toward your monthly benefit contribution. You will keep track of your incentive and report your activities in the My Active Health portal at www.myactivehealth.com/SOM. The Employee Assistance Program, or EAP, assists employees and family members by providing counseling service, 24-hour crisis help, and many other life balance resources. Call the number on the screen or visit the RBH website at www.myrbh.com, access code Montana, to access these very important benefits. Enrollment in the state plan is not required. For additional information, refer to the New Employee Benefits book or visit the HCBD website. Here are some ways that you can make the most out of your state plan benefits. Doing these things saves you and the state plan money. First, use participating providers and in-network pharmacies. Visit the HCBD website for links to participating providers and in-network pharmacy directories. Another thing you can do is review your medications. Some medications qualify for the 90-day fill at a retail or mail-order pharmacy. When you fill 90 days at a time, you will pay 2 co-pays versus 3 and receive 3 months of medication. Use a Montana Health Center whenever you can. The Montana Health Centers provide primary care at no cost to you. Take advantage of the no-cost wellness and prevention programs available to you. Participation in these programs could reduce the amount of your monthly benefit contribution. And finally, please be aware that vendors may contact you with informative, cost-saving programs for you to participate in. They will never solicit your personal information, and your decision to participate is optional. Open enrollment is that time each fall in mid-October when the state plan provides information about any changes in benefit contributions or benefits coming in the next plan year. It's also the time for you to make changes to benefits, like opting back into the Vision hardware plan or renewing your flexible spending accounts. Any changes you make are done online and take effect the following January 1st. We highly encourage that you watch an education presentation to make sure that you're up to date on any changes coming in your benefits for the next plan year. You may be wondering who you should contact if you have a benefit question. If you have a question about eligibility, who is covered on your plan, mid-year changes, payroll deductions, or the Live Life Well incentive program, you should contact Healthcare and Benefits, or HCBD. If you have a question about claims, bills, or EOBs, explanation of benefits, participating providers, individual account information, what's covered, pre-authorizations, or how to make a Montana Health Center appointment, you should be contacting our third-party administrators like Allegiance, Navitas, Delta Dental, the Standard, or the Montana Health Center. Refer to the back of your New Employee Benefits book for websites and contact phone numbers. Thank you for viewing the New Employee Benefits presentation.